We have Lisa with us today. Lisa is 54 years old. She's been a patient for 5.5 years, since July of 2003. And she's been on testosterone for that time, 5.5 years. At the time that we started her on testosterone replacement therapy, she was also perimenopausal. And was experiencing perimenopausal symptoms with some flashes and erratic periods. But let's talk about from the testosterone side, about what you were like before we started testosterone replacement. Let's start with the physical, as far as your energy and your strength and stamina.
I was always very tired. I started getting a little depressed. I had mood swings. And once I started taking the...
Well, let's just talk about before you took anything.
Oh, okay.
Was the lack of energy, the tiredness severe?
Yes. And by midday, I was ready to go to bed. That's how bad it was.
And how long had that been going on?
A few years prior.
A few years. Was it getting worse?
It was getting worse. It was up 6 months before it was at its worst, before I started.
Did you go to the gym at that time?
Yes.
And how was your stamina at the gym?
Eh.
Yeah?
Eh.
Okay. You mentioned that you were feeling depressed before the testosterone.
Yes. Yes.
Severely depressed, moderately depressed? How would you quantify it?
Sporadically depressed.
And was that something new for you?
Yes. Yes.
How long had you had that?
It started again 6 months before I came into you.
About 6 months?
Yes.
So it started at the same time as the fatigue?
Yes.
Okay. And also you've been having anxiety, or were having
Always
anxiety?
had anxiety all my life.
Your whole life?
My whole life.
Had that been changing at all prior in that last year before we started testosterone?
No, my anxiety wasn't changing.
That
Not
was
at all.
just stable your whole
Oh,
life?
yeah.
And your sexuality? Had you been noticing any decline in that?
Yes. A few years before that, there was a decline in my sexuality.
In what way?
I didn't get aroused as easy as I usually do, as I had been getting.
And what about your lubrication?
That was always there.
Okay. And what about your physical responsiveness to sex?
Well, it started dwindling.
Started dwindling. Okay. We started her on testosterone replacement in August of 2003. And at that time I was using much larger doses than I use now. We started her on 100 to 120 milligrams a day. Not a day, every 3 weeks. What did the testosterone do for you? As far as your energy and stamina?
My stamina was great, like I was young again, in my 20s and my 30s. My energy level was wonderful. You know, again, like I was in my 20s and my 30s. I noticed, though, from the larger doses that I was getting very aggressive.
Okay, we'll get to the side effects in a few minutes. Did you notice any difference in your ability at the gym?
Yes, yes. I was getting strength in the gym, more strength. I was able to pull more strength in the gym.
Okay. Significant?
Yes, gradually, yes.
Okay. And what happened with the depression?
Everybody gets depressed. I don't get depressed the way I used to get depressed.
Significant difference?
Yes, big difference.
Big difference.
Yes.
And what happened with this lifelong anxiety?
I'm not as anxious as I used to be. I'm not as anxious as I used to be. I'm not as nervous as I always was.
And has that been persistent for the whole 5.5 years that you've been on testosterone?
Yes, absolutely.
Okay. And sexually?
Sexually, it's still good, and I'm 54.
Good libido?
Yes.
Good?
Responsive, yes.
Everything good?
Yes, thank you.
And the ability to get easily aroused returned like when you were?
Yes. Yes, in my 20s and 30s.
In your 20s and 30s. Good. Now, you mentioned before that at the beginning you noticed an increase in aggressiveness.
At the larger doses, I've noticed terrible increase in aggressiveness, which was no good, but that's...
Was dose related, you found?
Yes, it was dose related.
Were there any other side effects?
No, that was the only bad side effect for myself.
You had some hair growth?
Yes, I had hair growth.
at the larger doses.
Yes.
Okay, and now from 100 to 120 milligrams every 3 weeks, you're now taking 20 milligrams
Yes,
every 3
yes.
weeks. And what's happened with the side effects? Is the aggressiveness still there?
No, the aggressiveness is not still there. The hair is still there, but not as bad as it was.
Is it a significant factor?
No, not to me it's not, because I can always have it taken care of. It's
Okay,
not a big deal at all.
not a big deal.
No,
And all of the positive effects that you had from testosterone?
are still there.
They're all still
I
there?
still have energy. I can lift heavier weights at the gym. I don't get depressed. I'm not as nervous as I used to be.
And good sex?
And my sex is great at 54.
You mentioned something before that you know when you're due for a shot.
I get tired. By 11 o'clock in the morning, I know the 3 weeks are up and I need a shot.
And then you perk up?
Yeah, I'm fine. I'm great.
Okay.
It's great.
What would your recommendation be to other women?
I would recommend it to other women. I mean, everybody has to know what their dosage is,
Yes.
all right? And it's good that you let people know the side effects. This way they can look out for the side effects.
Right.
But absolutely, women over 50, yes.
Sometimes even women over 40.
All right, but I'm sorry.
Okay, well, thank you very much.
Thank you, though.
Very nice.
Thank you.